Is my horse lazy or in pain? Understanding osteoarthritis, behaviour changes and pain relief options by Sue Palmer, the Horse Physio. Let me tell you about a pony I saw recently. He's 18 years old and his owner had noticed something had changed. When they went hacking, he'd become much less forward going. He wasn't striding out in the way he used to. He was reluctant to move faster, and he needed more encouragement. At the same time, he'd become more spooky. Not just ridden, but also at liberty and in hand. Now this is something I see quite often. A horse changes behaviour, and the question becomes, is this training? Is it temperament? Or could it be pain? In this case, the veterinary surgeon suspected low-grade discomfort associated with osteoarthritis, probably in the hocks, and suggested trying pain relief. But as always with horses, it's not quite that simple. Owners immediately start asking questions. Should he be on bute? Should it be Danilon? Would Equiox be safer? Should the medication be given every day, or only on the days he's ridden? If it's just on riding days, should it be given the evening before, the morning of the ride, or afterwards? And then there's another question. Is long-term medication safe? And perhaps the biggest question of all, should he even still be in work? These are all very sensible questions, and they don't always have simple answers. But before we talk about treatment, we need to start somewhere else. We need to start with recognising pain. Pain doesn't always look like lameness. Many people still expect a horse in pain to look obviously lame. But chronic musculoskeletal pain in horses often doesn't look like that at all. Equine orthopaedic consultant and researcher Sue Dyson has spent decades studying this. And she explains that many horses with low-grade pain don't show clear lameness. Instead, what we see are subtle changes. The horse may shorten the step length. There may be less impulsion. The movement becomes a little flatter. The horse becomes less willing to work. And sometimes behaviour changes too. The horse might become tense, or reactive, or spooky. The reason this can be so difficult to recognise is that the pain is often present in both limbs, for example both hind limbs, so the horse doesn't appear uneven. Instead, the whole movement simply becomes smaller or more restricted. These changes often develop gradually, over weeks or months, and it's very easy to miss them. Unfortunately, when we don't recognise pain, we often explain the behaviour in other ways. We say the horse is lazy, or grumpy, or stressy. But very often, the horse is simply trying to tell us that something doesn't feel comfortable. Osteoarthritis in horses. One of the most common causes of chronic pain in horses is osteoarthritis. In fact, osteoarthritis is responsible for around 60% of lameness cases in horses. For many years, people thought arthritis was mainly a problem affecting cartilage inside the joint. But we now understand that osteoarthritis is actually a disease of the entire joint. Inflammation within the joint can lead to a number of changes. Cartilage can break down. The joint capsule can thicken. The bone beneath the cartilage can harden. And sometimes bony growths called osteophytes develop around the joint. All of this can lead to discomfort and reduced mobility. The important thing to remember is that horses are living longer and staying active for more years than ever before, which means osteoarthritis in horses is something we're seeing more and more frequently. Recognising osteoarthritis in horses. One of the challenges with arthritis is that the signs are often subtle. Owners might notice that the horse becomes reluctant to move forward. The horse may resist the rider's leg. He may feel tense under saddle, or he may become more reactive or spooky. To help recognise these signs, Sue Dyson and colleagues developed something called the Ridden Horse Pain Ethogram. This is a list of 24 behaviours that are much more likely to be seen in horses experiencing musculoskeletal pain. Some examples include ears pinned back for several seconds, the tail clamped or held to one side, repeated changes in head position, spontaneous changes in gait, or reluctance to move forward. Research has shown that when 8 or more of these behaviours are present, musculoskeletal pain is very likely to be involved. And importantly, when the source of pain is treated, many of these behaviours reduce or disappear. When a horse is reluctant to go forward. One of the most common things owners tell me is this: my horse just doesn't want to go forward anymore. A horse that used to stride out hacking suddenly slows down. The rider needs to keep nudging with the leg. Transitions feel sticky, or the horse seems unwilling to move faster. And it's very easy to assume the horse has simply become lazy. But reluctance to go forward is actually one of the most common signs of discomfort. When joints are painful, particularly the hocks or hind limbs, the horse instinctively tries to avoid engaging the hind quarters. And forward movement requires exactly that. So the horse slows down. He resists the leg. He may hollow his back. Sometimes he becomes tense or spooky. Recognising that a horse reluctant to go forward might be experiencing discomfort rather than disobedience is an important step in improving both welfare and performance. Pain relief options. When osteoarthritis is suspected, veterinarians often start with medication to reduce inflammation. The most common drugs used are non-steroidal anti-inflammatory drugs, usually called NSAIDs. These include phenylbutazone, which most people know as bute, Danolon, which is succinylbutazone, and Firoxicab, Firocoxib, often sold as Equiox or Previcox. These medications work by blocking enzymes involved in inflammation. Bute is widely used because it's effective, affordable and familiar. However, it has a relatively narrow safety margin. Firocoxib is a little different. It targets a specific inflammatory pathway and may cause fewer stomach-related side effects. Studies suggest that both types of NSAID provide similar levels of pain relief, so the choice often depends on the horse's medical history, the veterinarian's preference, and sometimes cost. How often should pain relief be given? This is one of the questions owners ask most often, and there isn't always a single correct answer. Some horses benefit from continuous low-dose medication. Others only need medication on the days they're ridden. If medication is only given on riding days, it usually works best when given before exercise, so the horse is more comfortable during the ride. Often, the best approach is simply to try a protocol and monitor how the horse responds. Are there risks with long-term medication? Like any medication, NSAIDs do carry potential risks. These include gastric ulcers, intestinal problems, and kidney issues. However, many horses tolerate these medications very well when they're used carefully and at appropriate doses. The goal is always to use the lowest effective dose and to combine medication with other management strategies. A multimodal approach. Pain management rarely relies on just one treatment. Veterinarians often talk about a multimodal approach. This simply means using several different strategies together. For example, medication, joint injections, physiotherapy and rehabilitation, appropriate farriery, weight management, and carefully planned exercise. Each treatment might only help a little on its own, but together they can make a significant difference to the horse's comfort. Should horses with arthritis stay in work? One of the most important things for horses with osteoarthritis is movement. When horses stop moving, joints become stiff and the surrounding tissues tighten. This can actually make arthritis worse. So rather than stopping exercise completely, the aim is usually controlled movement. For some horses, that might be hacking. For others, it might be groundwork, or simply regular turnout. The exact approach depends on the horse, the joints involved, and the severity of the arthritis. The goal is not to push the horse beyond comfort. It's to keep the horse moving in a way that supports joint health. Listening to the horse. The pony I mentioned at the beginning is lucky. His owner recognised that his reluctance to go forward probably wasn't laziness. She understood that his increased spookiness might be linked to discomfort, and she recognised the importance of maintaining movement rather than simply stopping everything. Pain and behaviour are closely connected. When a horse becomes reluctant, tense, or reactive, it's always worth asking a simple question. Could this be pain? Because very often the horse is simply trying to tell us something, and when we listen carefully enough, we can help them stay comfortable for many years to come. If you'd like to learn more about recognising pain-related behaviour in ridden horses, my book Harmonious Horsemanship, which I wrote together with Dr. Sue Dyson, explores the ridden horse pain ethogram and how understanding these behaviours can transform both welfare and performance.